Sure. So every patient that comes in, it's important that they wear a sunscreen, whether they're newborn all the way into old age. But there's some considerations that you want to take into account for children less than 6 months. So sunscreen, like I said, is still important for them, but the way that you want to apply it and some things you want to think about are a little different than for an older child. So one of them is that infants or children under the age of 6 have a larger body surface area to body volume ratio. And so with that, there is some concern that some of the ingredients in sunscreen, either the active ingredients or inactive ones, can potentially be absorbed and cause problems in small children. Most studies don't find that that's a real problem, but it's still something to think about. Science is always learning. And so I think it's important that we try and be conservative when we can. So in children under 6 months, sun avoidance is going to be the most important thing for them. Using sun protective clothing, staying indoors, seeking shade when possible. Now, if you are going to be outside with a child under 6 months, try and only apply sunscreens to sun-exposed areas. So the cheeks are going to be an area, the forehead. The hands, you may want to be a little hesitant to put that on, as little kids tend to put their hands in their mouth, and so we don't want sunscreen going there. But it's still important for children to be sun protected, especially under the age of 6 months. For older children, you can pretty much treat them just like adults as far as sunscreens go. So after the age of 6 months, same ingredients, zinc oxide, titanium dioxide are going to be the best ingredients to look for, an SPF 30 or greater to apply to them about every 2 to 3 hours. Sunscreen starts to come off as far as sweat, or if we're out swimming, that sunscreen begins to come off. So reapplying is going to be very important as far as sun protection goes.